I'm here with Dr. Lawrence Baker from Stanford Medical School, and we're going to talk about healthcare costs or healthcare economics, which you're an expert in.
I like to spend a lot of time
You
thinking
try
about
to
health
be.
economics and stuff like that. Yeah.
So all of these charts, which all seem to have a similar shape here, these are essentially measures of how much we're spending on healthcare. So this first one right here was this total health spending 1960 to 2009.
Yep.
This is the United States.
This is the United States. This is data that's compiled by the federal government every year since, 1960 in this figure.
And is this adjusted? This isn't adjusted for inflation.
That's not adjusted for anything. That's the total dollar value that the folks in the federal government who like to calculate this number have come up with for the amount we spend on healthcare in a year.
Okay, so someone looking just at this data point might say, okay, maybe it's not inflation adjusted. Maybe the inflation curve is also growing at some rate here. But the absolute numbers do seem to be large. You're saying by 2019, I guess it's already, 2009, we're already several years past that.
We're past that, yeah.
We're $2.5 trillion, just to make people clear what we're talking about, because this is in billions. This is 2,486 billion.
That's
so
right.
that's $2.4 trillion, and then that's projected to almost double by 2019.
That's right.
We're and our GDP is on the order of $15 trillion. So it's a significant chunk of everything that we produce.
That's a big chunk of everything we produce. And going up rapidly. Hard to predict a little bit, but all the trends are up, and so we're worried about.
And this is on a per capita basis. So I guess there's two ways to think about why costs are going up. Mm-hmm. One is that maybe you just have a lot more people,
right?
Or that on a per person basis you are spending more,
right?
And this chart seems to imply the latter.
This says on a per person basis we're spending more. Still not inflation adjusted in this.
Still not
chart,
inflation adjusted.
But going from $100 or so in 1960 to $8,000 in the last couple of years, and you can see the trend since say 2005 in there. It's up, and it's up pretty steeply.
Right.
Just in the last little bit.
Right.
Headed for maybe 13 or 14,000.
13 or 14,000. That's a nice subcompact car one could buy.
Yeah, I suppose so.
Not to say what's more important. And then this next chart right over here is actually that calculation as a percentage of GDP. And to me, this is maybe one of the most relevant things, because that adjusts it for things. It doesn't directly adjust for inflation, but it says, look, as a percentage of all of the goods and services as an economy that we're doing, this is a percentage.
Right.
So this is an interesting one right here. So in 1960, roughly 5% of everything that all the goods and services that Americans produced, 1 in 20 of our energies was spent towards healthcare.
Right.
And now it's looking like it's closely. In the next few years, it's going to be approaching 20%. It's already in the upper teens.
It's past 15%, 16%, and we're headed up. The last year or so maybe it was a little slower growth, but you can see the trend over the last decade or 2 decades. It's up and up. So you're right. When health economists, when people who think about this more deeply want to think about healthcare spending, $2.5 trillion is an interesting number. 8,000 is an interesting number. But this one captures population growth to a large extent, captures inflation, and the fact that we're spending $1.07 roughly of our productive capacity on healthcare is an interesting and
closely approaching one. Actually, it's already 1/6 and approaching 1/5.
Yeah.
Of everything that we do is about healthcare.
Yeah.
And I guess. I mean, there's a couple of things there. Maybe we're getting healthier, I guess, is one possibility. Or maybe we aren't, and then something's weird.
Well, that's the really interesting question. We think about why this is going up, but at the end of the day, you're happy if we're spending this much, and if we're spending more than other countries, we're spending more than we did last year. If we're getting healthier because of it, or if we're getting happier, interesting question. If we want to count happiness, that doesn't make us healthy. But if we're getting something we value, and we're getting worried, and we get worried if we aren't sure that's happening.
There are many forms of happiness that do not make you healthy.
I think that's right. Though this is, at the end of the day, that's maybe our biggest question.
Some will act directly against your health, but that goes straight into this chart. What you're talking about is like, well, maybe we should, or maybe we shouldn't compare ourselves to other countries, and this is comparing ourselves to other countries. So this chart right over here, this is the blue graph. So we are this light blue. I'll do it in that same. So this is us. This is the United States right over here.
Yep.
That is us, the United States. And if we compare to other developed countries with, I guess, not too different demographics in terms of...
Yeah, and overall developed countries, industrialized countries where the standard of living is in pretty good shape.
Right. And they have a broad, it's not a homogenous
not entirely homogenous. So people will
Country.
will say the U.S. is more diverse than
Right.
some of
The
the
United
countries in
Kingdom
Europe. But
is quite diverse.
pretty diverse countries generally,
country
and
now,
you know, certainly countries with immigration issues that the U.S.
Right.
has, countries with lower income and higher income populations that the U.S. has. So they're pretty diverse.
Right, and
kinds
so
of
I
countries.
mean, when you look at this is actually maybe this is the real chart to look at, because this gives you the percentage of GDP, but also puts it in context of other countries, and that's where they're all kind of bundled around in this. You know, I don't know, at the low end, it was this actually the UK. I didn't realize is actually at the low end as a percentage of GDP. All the way at France is at the high end of GDP, and
Yeah, so I've done a little picking and
Yeah.
choosing of the
Yeah.
European countries here. There are some that are a little higher, but nobody
Yeah.
comes close to the U.S.
Right.
These are the big ones. UK is the lowest in the world, really, of the developed countries, the European countries. And France and Germany, Canada, common comparators to the U.S. at 10 or 11%. So we're 50% higher, 60% higher than those, double what's going on in the UK.
And do we know why we're doing this, or you know, are we getting? I guess where is that going? Where are we spending money that these other countries aren't?
Right. So two places. Ultimately, the economics of it would say if you're spending more than somebody else, it's about how much stuff you're buying, what kind of things you're buying, and
Right.
then the price that you're paying
Right.
per thing. So we're talking either about prices or quantities.
Right,
P times
right.
Q. So it's a little bit of both. If you compare us across countries, we buy more of some kinds of services than
Right.
other countries buy. There's some interesting comparisons.
So like we might get more MRIs per person or something like that.
We certainly do get more MRIs per person. It's kind of interesting. It's not that we have more doctors per capita, say,
Right.
or more hospital beds per capita. It's not that we get more primary care visits in the U.S. It's actually true that in many European countries you get more primary care visits, more time with your primary care doctor than we get in the U.S. But it's you know, if you're picking a poster child, it might be the MRI or something more sophisticated,
Right.
some of the more expensive specialist visits, lots of tests and things like that we buy in the United States that you don't buy in Europe, and that drives up our healthcare costs.
So it's definitely, so we definitely are buying more, and it's costing us more per.
And the price is also different in the United States.
Right.
And there's some people who've done studies of this, and there's always little bits of debate about how you define these prices exactly. But
Right.
you know, we pay doctors, and if you're finding doctors' annual incomes, they're going to be higher in the United States. That
Okay.
is to say, we're paying, in some sense, a higher price for a year of work from a doctor than they pay in Europe. We're paying a higher price for our hospital administration, for our staff in the hospitals and things. We're tending to
Right.
pay more. So we buy more things. We tend to buy more of the more expensive things,
Right.
and we tend to pay a higher price.
You know roughly
each
how
thing.
much of the healthcare dollar goes towards salaries versus drugs versus things like MRIs and kind of fixed costs like MRIs in hospital and beds and things like that.
Yeah, so some of this you can figure out. I
Yeah.
mean, we could almost put another slide up on
Yeah.
your on the figure there, or on the screen there. The U.S. health accounts will tell you some things like doctors and hospitals and drugs. Drugs, 10 or 15%, a little less than that.
Okay.
I'd have to go back and look at the data on physicians, but physicians, let's say that hospitals and physicians are 20 or 30. I
20,
actually
okay,
I actually
roughly.
hesitate to give you
Okay.
the number. We can
It's
figure out
not
the-
90%.
It's not 90%.
When we say hospitals and physicians, that includes outpatient and inpatient.
Yeah,
Instead.
there's lots of the ways that these health accounts get broken up.
Right.
Physicians, hospitals, emergency departments,
Right.
different kinds of equipment and things that get purchased, and there's research and there's buildings and all that kind of
So,
stuff.
but just physician pay. Once again, none of these things do make up the bulk of it. And we had a video about drug pricing, but drug pricing by itself is not the reason why we're out here. And physician pay by itself is not the reason why we're out there, or even having more. All of these are contributing. It seems like all of these
it's
we're
a
getting
mix.
more of, and we're paying for.
It's a mix. I mean, at the end of the day, it's going to be a bunch of things like this all thrown together. We buy more stuff. We tend to buy more expensive stuff. We buy it from people who we pay a lot to. We buy more specialist visits. For
Right.
example, in the U.S., we pay specialists a higher annual salary than we pay generalists, and that comes out in the prices.
They don't do that in Europe.
Europe does pay more, but
Right.
everybody's shifted down. All the physicians are so shifted down, and I think the specialists are probably shifted down more in Europe than the generalists are.
I see.
We pay more for our prescription drugs here. We pay more for...
Now, what are we getting in terms of, other than more Mercedes in the doctor's parking lot? No, I'm kidding. I'm kidding. No. Although you do see a lot of them.
There's a lot of good business for
seems to be the car of choice
dealerships.
when I visit the doctor. But what is, and I'm not saying that my wife's the physician, and obviously we all work with many, so they've worked very hard. So I'm not going to say that they're make any statement about their underpay or overpay, and especially relative to some people I knew in the finance world, I would say that they're definitely underpaid.
Possibly.
Yes. They're above Mercedes in that world. Right. So are we getting anything in exchange for this? Are we getting less wait times? Are we getting a better access to our doctors? What are we getting, or what do we know about that?
Well, so this is the debate. This is in maybe a microcosm, one of the big debates we're having in the U.S. right now. We're spending more every year. We're spending more than other countries. If it was clear, we were twice as well off, twice as happy as Britain.
Too, and we're growing faster.
And we're growing. So it depends on how you look at the timing, but we're growing a little faster in some years.
Yeah.
Our healthcare costs go up 10%. If we knew we were 10% happier this year with our healthcare system, we'd be happy. And that's the big debate. There are some cases, where the U.S. There are things you can point to. We have fewer waiting lines for some services, and some of the countries that keep the costs down have more lines. But it's also not the case that they have waiting lines for everything, and the really serious stuff doesn't tend to have long waiting lines.
See.
We get easier access to some of the high tech stuff, which we like, and so that drives up our spending, but maybe makes us happy.
But it may or may not lead to better outcomes. So it makes us happy that we feel like we're getting better customer service. Instead of waiting 3 months for a procedure, we're getting it in 3 weeks, which would make me happier. I mean, objectively, I would be much happier about that.
Right.
But what happens when we look at the overall outcomes? Life expectancy and people dying from heart disease or whatever.
This is kind of a mixed bag. There are some of the most commonly cited figures are cases where the U.S. doesn't do as well as some European countries. And usually it's we spend a lot more. We don't do better on life expectancy. We don't do better on infant mortality. There are some cases where the U.S. does really well, especially things where access to the high end stuff can make a difference. And so there are some situations where it looks like we buy the kinds of things that are really going to make us healthier, but it's not across the board. And some of the really interesting ones are cases where there's fairly inexpensive stuff that looks like it would work well and improve outcomes, and sometimes we're not doing the inexpensive stuff that other countries are doing, and it's coming out to maybe hurt us in our outcomes. So there's we wouldn't be having the debate if we were clearly better off, but it's really the case that in only some of the measures do we end up better off. We don't always vaccinate our kids more. We don't always get people screened more for cancers and things like that, but sometimes we do. So there are cases, there are success stories here.
Now one thing that's interesting looking at this chart a little bit deeper is that it doesn't look like this is something that since the American Revolution that we've been spending double as a percentage of GDP relative to everyone else. I mean, if I just look at this chart right here, it seems like us in Canada, we were right along, very similar to each other to about the early 70s, but we were still in kind of that pack with Germany and France. I guess relative to the UK, we actually always have been higher. But then right around this time period there, I don't know if late 70s, early 80s, that's where we really started to break off. Was there some policy shift there? Or?
So there's not a tangible, specific policy shift. What starts happening in the U.S. there is we start adopting and we start shifting toward the higher end stuff more, and some of that's the population.
That's when the technology started to really get.
I think that's mainly the story. We started to really the research and things, the development that went on in the world really from 1940, 50, 60 started to produce the capacity to do new and expensive things, and the U.S. grabbed those, and other countries in the world were less quick to grab them. Maybe you could say more careful, maybe you'd say too careful, too slow. But the U.S., as you see there, really quickly started to put up specialized hospitals, started to buy the fancy equipment, and you can see what kind of came out of it.
Cool. And to some degree, probably the whole world benefited from that, because you are going back to the drug pricing or the MRI manufacturers. They're able to get those returns, and hopefully much of that they're able to reinvest and not spend too much on other things. But it is fueling. Yeah,
some of the innovation. If there's always these kinds of questions that swirl around here. If the U.S. pays a lot of money and that comes back into innovation that everybody benefits from, including us, maybe it's okay.
Right.
I think there are people who debate whether we got enough innovation and enough benefits that's tangibly related to our spending to make our spending worth it. But there are some cases where that probably happened, and so there's some subtlety to the question. But I always say if you're the Yankees and you're going to pay the huge amount for the for the big payroll and the big stars, people expect you to win every time, and that's the kind of the U.S.'s challenge. We're going to pay the big bucks.
We should show
we
results.
really feel like we want to show results every time, and sometimes we do get the results, but
it's
not
not
often enough.
ambiguous. It's not ambiguous. We're not winning the championship every
Right.
year. Very, very interesting.